how is it that you primarily have been trying to cope with what has happened to your body and your mind? And just know that whatever it is, that's been a protective response on your part. It may not have always served you well. And sometimes things such as workaholism, alcoholism, substance use, sexaholism, many isms can be one way in which people try to protect themselves. Not always helpful, but it's your attempt nonetheless. And then secondly, I have been taking care of my heart and soul by blank, blank, blank. What have you been doing to try to take care of yourself? What have you been doing to try to cope with the memories that have invariably haunted you day and night? With the irritability, the stress that you know is tied to those experiences in war. Again, I invite you to complete those two sentences to know further about how you have been protecting yourself and how you have been taking care of yourself. What I'd like to talk about now is something that is a little bit provocative in our field, and that is to say that post-traumatic stress disorder is not a psychological illness. It's not a psychological illness. That doesn't mean it doesn't have psychological consequences. That doesn't mean it doesn't have psychiatric, psychosocial, and community consequences. It does. But at the end of the day, war trauma has affected your whole mind and body. And as you can see depicted in the image, the way it does that is our body and mind is connected such that war stress and further stress has an effect on the limbic system in the brain, down through the adrenal glands, and back as a feedback to the brain. All of this affecting many organs in our body. And centrally to this program, our heart. So the amygdala in the temporal lobes of the brain on both sides is kind of like the gas pedal. And in post-traumatic stress symptoms or disorder, the amygdala is on a lot. It is as if you're on overdrive, most of the time without the ability to really cut that off. The brake does not work so well, and the brake is located in our brain in the prefrontal cortex, in the front of the brain. And often when we see something that is bothersome to us, our amygdala is going overdrive and trying to protect ourselves. Meanwhile, the prefrontal cortex is trying to recognize, is this something we need to be afraid of? Is this something we need to really worry about? It has been shown scientifically in people with post-traumatic stress disorder that part of the brain does not work, and the amygdala is on overdrive, pulling memories out, intended to protect yourself. But the consequence is that the alterations that happen in the brain centers, the hypothalamus down to the pituitary, down to the adrenal gland, is that you have higher adrenaline running around your body and you have lower cortisol. Cortisol is often produced to counteract the effects of adrenaline. Adrenaline is needed for the fight, flight, or freeze response. And cortisol is needed to help cool the body down when that fight, flight, or freeze response is no longer needed. This causes a higher turnover of cells in the walls of your arteries in your heart, and specifically to your heart. High adrenaline and fluctuating levels of adrenaline, it's harmful. It's harmful to the heart muscle, but as importantly, it's harmful to the lining, the arteries, and the cells lining the arteries. That leads to a higher risk of atherosclerotic heart disease, higher blood pressure, decreased heart rate variability, which is the way the heart cycles, and more resistance to insulin. And more resistance to insulin in your cells means you're at a higher risk of diabetes mellitus. So, the change in health behaviors that is caused by this often is that we decrease our movement. We change our eating, we tend towards more substance use to feel better, and our sleep is disturbed. And those behavioral consequences are also significant in hurting us and in perpetuating the stress response in our body. So, Some of you have never wanted to go and get mental health care for these symptoms because you know you're not a person who's a patient with mental health issues necessarily. You know this has affected your body. Many of you have gone to doctors, to emergency rooms with your body on overdrive, and they tell you it's psychological or psychiatric, and your response is, some truth to that, but doc, this is in my body. I really want to know what's going on with my heart, my lungs, my stomach, my gut, etc. And guess what? You've been right. So, PTSD is not a psychological disorder. It's a whole body, mind-body illness, yet it does have psychological consequences. I'm going to pause right now and just allow you to think about this, to study more. We will have some links up that you can go to other resources about this issue. For now, I invite you to take some notes and some takeaways from this material that we've just discussed. See you in a bit.